Too much filler can ruin your facelift outcome, and most patients have no idea why. I see this in my practice. Some patients come in for a facelift consultation, and during the examination, I noticed that the tissues feel different, heavier, less mobile, with an unnatural fullness in certain areas. When I ask, it turns out they have had repeated filler treatments over the years, and that changed how I planned the surgery. Here's what most people don't realize. Filler doesn't just sit there quietly. Over time, it does three things to your face. First, it disrupts your lymphatic system, your body's natural drainage network. When that's compromised, fluid builds up. That's why some people look perpetually puffy and swollen. They think it's aging, often it's accumulated filler. Second, it changes your tissue quality. Repeated filler stretches the skin, creates irregular deposits, and makes the tissues heavier and less elastic. From a biological standpoint, you are altering the mechanical properties of the soft tissue, and that matters in surgery. Third, and this is what concerns me most, it distorts the surgical anatomy. A deep line facelift requires precise identification of tissues. I need to see clearly and feel clearly. When there are years of filler deposits in the way, that precision becomes significantly harder, and it doesn't stop there. Filler can affect how the skin redrapes after surgery. It can interfere with the jawline definition and neck contour that facelift should restore. In some cases, old filler triggers a foreign body response, granuloma formation, or even delayed infection. These are well-documented complications in the literature. So what do I recommend? In most cases, dissolving all filler before we even discuss a surgery date. I use filler dust to break it down, and then I wait. I want to see the face return to its true baseline, the real volume loss, the real skin laxity, the real bone structure. Because understanding the actual anatomy is essential for surgical planning. And here is what's important. When I see volume loss after the filler is dissolved, I do not replace it with more filler. I address it during surgery using your own fat. Microfat for structural volume restoration, nanofat for skin quality improvements. This is your own living tissue. It integrates naturally, it behaves naturally, and it lasts. The biology is completely different from synthetic filler. You are not masking the problem anymore. You're actually solving it. A deep line facelift is about lifting and repositioning your own tissues back to where they anatomically belong. I think that with autologous fat grafting gives a result that looks natural because it is natural. Nothing foreign, nothing synthetic, just your own tissue in the right place. If you have had filler for years and you are now considering a facelift, it is worth understanding how that history affects your surgical anatomy. The quality of the tissue, the behavior of the skin, the accuracy of the surgical plan, all of these are influenced by what's already in the face. Being informed about this is the first step towards a better outcome.